Hi, I'm Dr. Judy Morgan, and today I'd like to talk about pain medications that can be used for our pets that have arthritis or other pain syndromes. Many times, pets are prescribed non-steroidal anti-inflammatory drugs, otherwise known as NSAIDs. The problem with NSAIDs is that they can have a lot of side effects. The most common side effects that we see are liver disease, kidney disease, or ulceration of the stomach or intestines. So things that people should watch for if their pet is placed on a nonsteroidal anti-inflammatory drug would be things like vomiting, lack of appetite, diarrhea, dark tarry stools, or general lethargy. Increased drinking and urination could be symptoms of kidney problems. Each particular drug is more prone to cause different problems or syndromes, and you should ask your veterinarian when your pet is prescribed one of those drugs what you should be watching for as far as specific symptoms for the drug. Some of the more common drugs that are considered NSAIDs would include Rimadyl and all of the generic forms of that, Metacam or Meloxicam, Deramax, Previcox, and there are many others on the market. Rimadyl was the first one that hit the market maybe in the mid to late 90s, and so that's the one that has been used most often and has been talked about most often. One of the common mistakes that I see with these medications is that people will run out of the medication, so they'll pick something off the counter at home to use instead. First of all, many of the over-the-counter medications that are used for people can cause big problems for our pets. Tylenol or acetaminophen is extremely deadly for cats and should never be given. It also can cause liver problems in dogs and should be used sparingly, if at all. I do not recommend using it. Other over-the-counter medications that might be used would be something like naproxen, which is Aleve, or ibuprofen, which is Advil and comes under a lot of other names. Those drugs have a high potential of causing ulceration and kidney or liver damage, and I do not recommend their use in pets. But the biggest problem is when something like ibuprofen or another over-the-counter nonsteroidal anti-inflammatory drug is combined with or used closely in association with the veterinary prescription drugs like Rimadyl or Deramax. The combination is deadly and will cause severe bowel ulceration and kidney disease, usually resulting in death. If your pet is on one NSAID drug and you and your veterinarian decide that your pet needs to switch to a different one because that one is not working very well, you need to leave at least 5 to 7 days between giving the two different drugs as a washout period. The first drug needs to be completely out of the system before a second drug can be added in. Another deadly combination is giving steroids at the same time that you're using an NSAID drug. The two together are bound to cause gastrointestinal upset and ulceration with possible perforation of the bowel. So those should never be used together. So for dogs with Cushing's disease who have a very high natural steroid content in their body, those dogs on nonsteroidal anti-inflammatory drugs are a potential disaster waiting to happen. So I don't recommend the use of nonsteroidal anti-inflammatory drugs in dogs with Cushing's disease. So what are some safer alternatives that can be used if we don't want to have our pets on NSAIDs? I like to use things like Doggone Pain or DGP. It's available over the counter. It's an herbal medication and it's made in Australia. And it's a very, very good product. It's a chewable chicken flavored tablet. So if your pet has chicken allergies, that might be a bit of a problem. I don't find it to be particularly palatable, so I usually have to hide it in something, but it does do a good job. Other things that can be used, Homeopathic Arnica, really, really nice for a safe anti-inflammatory pain medication that's not really a medicine. So that's a good thing that you can get over the counter and use with no problem. Can dogs take aspirin? They can take aspirin in low amounts, and there are dog aspirins available over the counter. The biggest problem with aspirin in dogs is that over 80% of dogs who are given aspirin on a routine basis, when we look at their stomach with an endoscope, we find that they have pinpoint hemorrhages and ulceration in their stomach. So just like aspirin causes problems for people and erodes the stomach lining, the same thing will happen with dogs. So I don't recommend long-term use of aspirin. And certainly aspirin can never be used in conjunction with an NSAID or within 5 to 7 days of giving an NSAID. For our dogs with SM and some of the neurologic pain, and also a lot of dogs with arthritis and spondylosis of the spine, gabapentin is a really nice painkiller and can work really well for a lot of dogs. For dogs that are still having breakthrough pain, then something like Tramadol can be added. Tramadol can have more sedative side effects, and it is a controlled substance, so it does have to be prescribed by your veterinarian, as does the gabapentin. Amantadine is another very strong pain medication. We usually wait and add that one on when nothing else is working. So there are a lot of different pain medications available. Be very careful if your pet is prescribed an NSAID. Be sure you follow the directions. If your pet has any side effects at all, please stop the medication, consult your veterinarian, and find something else that can be used. Do not try to mask the symptoms by giving a second drug. So one of the problems that I see is that dogs that get upset stomach when they're given an NSAID, the veterinarian might prescribe something like Reglan or metoclopramide or Carafate to coat the stomach and decrease vomiting. The problem with that is there can be a very dangerous side effect, particularly with something like Pepcid, which is an antacid, and NSAIDs used together. It can cause a very severe swelling of the stomach, which will actually close off and block the stomach. So do not use secondary medications to mask the symptoms that you're getting as a problem with an NSAID. You're better to just stop the NSAID and find something else that can be used for pain. Hope this answers some questions and gives you some help when choosing medications for your pet. Be very careful with anything over the counter or things that are prescribed. Make sure that you ask questions. Have a great day and take care of your pets. Thanks.